Welcome back to the channel, everybody. This short 2-minute video about a DMEK highlights one of the most important complications that you can have during this kind of surgery. So even from the graft injection, it's visible that the AC is shallow and doesn't want to deepen. There's a lot of posterior pressure. This usually happens with the retrobulbar block, which we always use for these cases when we're considering changing this type of anesthesia, mainly because this is the only real thing that can happen during DMEK aside from fibrin that can really mess up your whole surgery. So having posterior pressure and the inability to deepen the chamber will lead to almost any graft size being too big for that particular AC. And in this case, we had issues with flipping the graft. We tried to do it multiple times. This video is heavily edited. And finally, we've managed to do it. So we can see the proper S-mark configuration. But this is not the end of the case, because even if the graft is properly oriented, it's still difficult to position it and unfold it if the chamber shallows, especially if it shallows unevenly. For example, in this moment of the surgery, you can appreciate that the graft is a bit pinned towards the 6 o'clock position on the screen, and it doesn't really want to move with normal tapping. And even the Dirisamer taps don't really work that well, and they always end up shuffling the graft around. And now we're at the point of injecting the air, and the graft still doesn't want to move easily. And again, this is heavily edited, so we resort to direct manipulation. And this most of the times happens when you get a chamber that's not stable and is uneven. So we don't like to directly manipulate the graft, but sometimes you just have to do it. And after you've done that, the case becomes routine. You only have to inject the final airfill. And this was the purpose of the video, just to show that one of these two big complications, the fibrin and the shallow undeepenable AC, are two of the most important factors that you need to be aware of during surgery, and try to minimize the risk for posterior pressure during preparation of the patient and surgery. Thanks for watching.